Now to some good news regarding Bronny James, the son of the NBA's all-time leading scorer, LeBron James. Bronny has been released from the hospital. In a statement, Cedars-Sinai Medical Center says the 18-year-old is now resting at home after suffering a sudden cardiac arrest during a practice on Monday. His dad, LeBron, publicly thanked everyone for their thoughts through his social media. Bronny, by the way, is an incoming freshman for the USC men's basketball team.
And Keith, for parents, stories like this are certainly concerning. I spoke with Dr. Dale Yu, a McKinney-based cardiologist, to find out what you need to know, especially if you have a young athlete at home. The good news, he says it's more rare than you may think.
Overall, the condition of cardiac arrest in athletes is pretty rare, although it seems like lately we've gotten so much national and international attention to it. It seems like every person walking down the street may keel over dying. I think we get a lot of worried parents and family members for their, at-home athletes in middle school, high school, at all ages, really now calling us and wondering if they need to get full evaluation on their kids. But overall, the condition itself is still very rare. It's just in fields like ours, which basically in cardiac electrophysiology, which is a mouthful, we study the electrical part of the heart. It's a subset of cardiology in itself. So we see this, weekly, but overall the incidence is pretty low.
I think what's so scary about it to a lot of parents is in many cases, there were no previous symptoms. It just happened.
So the best way I can akin this when I talk to my patients and their families is it's like a light switch or a light bulb going out in your house. How do you know which light bulb is going to go out and when it's going to go out? You don't really know. As opposed to our other colleagues in the plumbing side of it, as we call it, interventional cardiologists deal with heart attacks all the time, which is usually a blockage in the plumbing system of the heart, right? When we talk about cardiac arrests or heart attacks, that's what we usually think about because for so long, that's what our minds have been known about, right? And now we talk about the electrical side of things, especially in these athletes, we're realizing that that's just as important and very sudden. So sometimes you won't have any warning signs at that point, although there are a few things we can do, but overall, there's really no warning signs until we have this.
When we talk about cardiac arrest in young people, we talk a lot about athletes. Are they more susceptible to this? Does playing a sport make it more likely that if you do have an underlying health condition, this would happen?
When we're dealing with athletes, they're pushing themselves to the hilt, right? They're pushing themselves to the maximum, and then some on top of that, right? We see it in professional and amateur sports all the time. So you're taking a condition that may increase your risk for whatever cause it is, as we mentioned above, and then you're pushing your body really hard. And sometimes when you push it really hard, you can be dehydrated, and that does play a role because your body's always trying to keep itself in balance. So when you're dehydrated, your adrenalines are high. Adrenaline levels are very, very high and pushing itself, to increase blood pressure, increase heart rate, which sometimes can do this as well and provoke it. Other situations, you're so dehydrated from sweating itself, you're actually losing a lot of salts. And those salts are very essential to the body and those channels inside your heart, namely potassium and magnesium. So in some of these athletes that have cardiac arrest, we can't find a congenital reason. We can't find another reason from inflammation or viral illness. And when we take a look at it, their potassium was really low and the magnesium was really low. So we repeat those and we attribute to that in those causes.
Doctor, you were saying that parents you hear from after something like this happens, concerned about their kids. What do you say to those parents that contact you?
So we first of all talk about the situation. Why are they worried in the first place? If it's just because they're seeing news reports, well, I tell them, hey, let's use this as a pivot point to see how is your health? How is your family's health? How's your child's health? Are they okay? Are they a diabetic? Are they overweight? Are they okay doing their sports? Because we want to make sure that, they haven't had COVID and are having heart problems because of that and other arenas. So I think this is a good time to say, hey, have you had your annual checkups for not only your child, but everyone in the family? And then on the other side, let's take a really good family history. I think we talked about this before when we were talking about DeMar Hamlin. Are there other, members in the family that have passed out when they were younger? Has that patient passed out? You may be 12 years old now, but what if you're 5 years old and you're having syncopal or pass out spells? We'd want to know if you're fainting all the time. So those things are pretty crucial to understanding whether or not there's more testing that needs to be done, whether or not we need to track this up to the parents and the grandparents and see whether or not there's conditions that may be involved in all three generations or further or more, and some of these congenital anomalies that occur are what we call dominant. So you only need one trait or one gene to be passed down. So 50-50 at every generation. And some of those conditions can make us think differently. So if we knew that our child had one of these conditions, we may not push them as hard to go play football in Texas heat. We may not push them to go be endurance and marathon runners. There are a lot of other sports out there, and also arenas that have people around and trainers around. These are controlled situations we've seen on a basketball court, on a football field. We want to make sure there are AEDs around. Prices come down so much. Some people have gotten them for their own households. And of course, all public venues should have them, and everyone should really know how to use them. So, and of course, we can't stress the importance of CPR, bystander CPR, meaning that all of us should know how to do that if we do see someone go down.
So, the big takeaway here is for parents, this is rare. It's not like it's happening all the time. I think we have a tendency to talk about it a lot in the media. It's happened to high profile athletes, so you see a lot about it, but don't conflate that with the number of happenings that are actually occurring. However, you do need to be aware. You need to know if your child has had issues passing out. You need to get them those regular physicals so that you're getting those checkups. So, cautiously aware and just know the dangers.
Dating myself a little bit, going back years and years and years and years ago, there are a couple of basketball players that come to mind. One was named Hank Gathers, one was named Reggie Lewis, and they actually, had heart defects, and one died after collapsing on the court, and one in a game, and one died after collapsing during a workout. And in this case, Damar Hamlin, he fortunately did not die. Bronny James, he fortunately did not die. So maybe what your story is pointing out that there are also medical advancements being made,
yes,
where people can stay on top of these heart conditions and maybe not go out there blindly, not knowing what's going on.
Right. Well, and then also add to that, more people know CPR, AEDs, and defibrillators are closer by. That makes a huge difference. The other thing is that the doctor talked about that I'm not sure we really had a chance to get to in that conversation, but not all of these cases are because of a heart defect. Damar Hamlin, for example, the helmet to the chest, basically that just acted as the perfect storm to stop his heart. It can be electrolytes. It can be the sports drinks that they've been having, if they're getting too much caffeine. There are a lot of different reasons that it can happen. It's not necessarily something that's a congenital heart defect, but all the more reason to be cautious. And then again, everything goes back to knowing CPR, having those AEDs and the defibrillators nearby, because that can really make the difference between life and death.
And maybe it takes the examples like the Damar Hamlins and like the Bronny James for people to see such high-profile people go through this and fortunately not lose their life, for everyone to now say, hey, let me learn some of this stuff.
Right.
Because it could happen to my child.
Yeah, it certainly raises awareness. I think, the doctor was careful in wanting to tell parents, you don't need to be fearful necessarily. Don't let this stop your child from doing sports. But, be smart about it and arm yourself with the things and the tools that can help save a life if unfortunately that ever does happen to you.
Every parent needs to be thinking about this as their child goes into extracurricular activities.